How I work to increase Latina mental health is that I make sure that I tend to those around me. I know in my position, I'm often a role model to other Latinas that are looking to come up and to make changes in their own life. And so I think being vulnerable and being willing to have a discussion and seeing the areas in my own practice where I can lean into others, start a discussion, share my own story, it really normalizes just the experience of being Latina and going up against sometimes really big forces that can be unsettling. And so I think it's just being there for other Latinas. That's really what I do the most.
So I work in terms of addressing and impacting mental health for Latina adolescents in a variety of ways. So in my clinical work, my day-to-day clinical work, I work in integrated pediatric primary care. I'm the psychologist, and so if a doctor identifies a mental health concern among any patient that comes in that day for a visit with them, they'll pull me in and consult on that patient. And what I'll do is I'll do a brief assessment or a brief screening to identify problems, come up with strategies, or things that they can do that day before they leave clinic to try and feel better, and then we work together to sort of come up with a longer treatment plan. That's what I do in my clinical work. In terms of my community outreach and engagement, I work a lot with different Hispanic social service agencies throughout Northeast Ohio and really throughout the state of Ohio in general. In terms of doing presentations on behavioral health concerns, I work with those agencies to help community members as well as community stakeholders sort of understand behavioral health concerns among Hispanic adolescents, but then also ways that they can provide support and ways that they can identify kids who may be having difficulties through their signs and symptoms. And then in research, I also do research with a lot of these different agencies in terms of trying to gather data, analyze the data to show that some of the programming that they're doing is actually having a positive impact on adolescent Latina mental health.
When I think about impacting Latinas, I think about the ways in which we've inherited valores and recetas and all sorts of wonderful things from our mothers and our grandmothers. And for me, it's important that when I'm working with Latinas, whether it's through teaching or through clinical work, that they are reminded of these valores and these strengths that they carry from their mothers and grandmothers. So reminding them of that and empowering them in that way is important for me. So hopefully we can continue to carry these recetas and beautiful legacies that we carry from our Latino mothers and grandmothers.
So I feel the best way to impact a community is to model behavior. When I was growing up, I had a lot of female strong women in my family who never really spoke about their strengths, never really patted themselves on the back. They were just there for the community through actions. And I think that's where I get a lot of my work ethic and my passion for just supporting other women. And I think when you're genuine like that, strong women gather together and you're able to empower, you're able to identify Latinas or Latinos who need that support and need people to surround them and tell them that they're strong, tell them that they're smart, tell them that they can do anything that they want to. So that's essentially what I concentrate on, and I feel like I give back to our community in that way.